Hi friends, tick bite, urgent care. Warm days have come to us, and along with the worms, ticks have come. Let's imagine that a tick has bitten us in a typical place, namely in the armpit, groin, back, neck, skin behind the ears or leg. What to do with him? In general, to remove the tick or not to remove? Well, first of all, of course, delete. Because when a tick is alive, it drinks blood from us. In addition, ticks are carriers of some very dangerous diseases. Therefore, no question on the topic, to delete or not. Remove it yourself, not in the doctor's office. What cannot be done? Indeed, there are such ideas that the tick needs to be smeared with something. For example, in America, most often they prefer to use nail polish or nail polish remover. In Eastern Europe, it's commonly believed that if the tick has nothing to breathe, then he will say, "Sorry, I got in the wrong place, come out and leave." Therefore, there are recommendations on how to smear it with some kind of fat or petroleum jelly, and also seal it with plaster or tape on top. But what are you supposed to understand here? The tick itself is not the biggest problem. The biggest problem is really that in the blood of a tick there can be pathogens of very dangerous diseases. For example, tick-borne encephalitis. This is deadly disease. There is a disease called Lyme disease or borreliosis. It's caused by microorganisms that look like bacteria. It's easier to treat than encephalitis, but if it's not cured in time, the consequences will remain for life. So when a tick is uncomfortable, when it feels bad and has nothing to breathe, it can, relatively speaking, burp its contents, and the likelihood that it will enter a person's blood is much greater. The tick may be because it needs to breathe. The tick may die because it needs to breathe. But the chance of infection is much higher. Therefore, we do not smear him with anything and let him breathe calmly, but not for long. To do this, we remove the tick. Now, the first thing to know before removing a tick. It must be understood that the head of the tick is in the skin, and the abdomen is on top. It's there in the abdomen that the most dangerous pathogens of infection. If we crush the belly, then the probability of getting sick is much higher. And not only for the victim, but also for those who touch this crushed tick with their hands. Therefore, it is always advisable that you use gloves. Now, how can this be removed? It turns out that already in the 9th century, people came up with various devices for extracting ticks. Once they were wooden. Now these devices have become made of plastic. For example, plastic tweezers with a slot. There is a much more serious device, for example, a special fountain pen with a loop for extracting ticks. In addition, you can use good adhesive materials, adhesive tape or plaster. In addition to adhesive tape and a patch, you can use tweezers. Grab as close to the skin as possible. Now, what are we going to do after we have removed the tick? There are two possible events. First, they remove everything. The second option, no matter how hard they tried, but the head remained in the skin. There is nothing particularly dangerous about this. In fact, it's a splinter, and it will in fact come out on its own with a few days. But when there is something left, no one can sleep peacefully. Therefore, you can act in much the same way as it is customary to act with a splinter. That is, take a needle, disinfect it, for example, with 5% iodine, and remove the head. After that, disinfect the bite sides with the same 5% iodine. When is a doctor needed? The most dangerous disease that is possible after a tick bite is a tick-borne encephalitis. There are countries or regions where tick-borne encephalitis is common. Your family doctor has been informed about this. Therefore, when you find a tick in the forest, you inform your doctor and ask how things are with tick-borne encephalitis in our region. If the doctor says that tick-borne encephalitis is common, then he recommends that you carry out special treatment, which consists in administering a special anti-tick-borne immunoglobulin. But it's possible that you live where there are a lot of ticks, or you are going on a trip where there are probably a lot of ticks. Then you need to do in advance vaccination. Nevertheless, we still remember that we are concerned not only with tick-borne encephalitis, but also with Lyme disease, borreliosis, which is just possible everywhere. The peculiarity is that after the onset of symptoms of borreliosis, we must undergo a standard course of treatment, which consists in taking a certain antibiotic, for example, doxycycline, which, by the way, is completely non-toxic. And then we will forget about this disease until the end of our days. But if we skip this, if we are not careful, then we will get a serious illness that will torment us all our lives. Symptoms of Lyme borreliosis are the appearance of red spots all over the body. If within 3 to 30 days after a tick bite, rounded red spots, usually ring-shaped, appear on the body, then this is a dangerous symptom. immediately to the doctor. He will treat you. And what follows from this? That when a tick bit you, you should mark this day on the calendar. You must clearly know there will be no symptoms for 30 days, so you can calm down. And the first possible symptoms of encephalitis are muscle weakness, fever, and muscle pain. They are possible within 2 months after the bite. These symptoms appeared, you need to run to the doctor. But one last thing you need to know. In the place where the bite occurs, separation is possible. If you see redness, pain, swelling, and increase in local temperature, then you go to the doctor. Prevention. First, prevention of tick-borne encephalitis is vaccination. Second, to provide protection against ticks in the forest is the right clothing. A hood, long sleeves, trousers that tuck into socks, elasticated sleeves, a jacket below waist level, and also tied with an elastic band. It's highly desirable that the clothes be light colored. It's easy to see the tick on light colored clothes. Try to choose wider paths. When you come from the forest, carefully inspect each other. Be healthy and see you soon.